All right, good morning and welcome to one and all. Could you just pop a 1 in the chat? Let me know that you can hear me okay before we move on. The usual drill. You know how we do this. We've got small numbers today, so everyone that's on this call is going to have to participate, I'm afraid. Yes, come on, give me a 1. There we go, Graham. I knew I could rely on you. Thank you very much. All right, here we go. So, as I say, few numbers on the call today. It is August, though, end of the season of holidays. And my son went back to school today. I don't know if anybody else on the call has got children going back this week, but it feels very, very soon. And yet, not soon enough, right? Anyway, right. What's happened since we last got together? Lots of things, I think. There's a vaccination programme being launched after concerns about the number of meningitis B infections. Obesity rates have doubled in England since 1993. This is why I don't watch the news, by the way, because there's also an unprecedented El Nino event that's developing over the Pacific Ocean that means we're all in for a rough winter. I mean, it's not all doom and gloom, is it? No, don't you worry, I've got some good news too. For starters, we are pleased to announce that Exxon Health has secured a place on G-Cloud 15, the latest government framework for public sector cloud services to aid and abet procurement. Can I get a woo-woo? Because that was a lot and I got it all out in one sentence. Woo-woo. That was a very quiet woo-woo from the those that have got mics, but thumbs up from the audience at large. Thank you very much. Paul, I love you, John Paul. All right, over the last couple of months, we've been talking about an overwhelming amount of tech that's out there at the moment. Thanks for us. We've talked about how connected ecosystems improve efficiency and operational experience. Today, we want to put it in the perspective of the patients and see how that plays out for them. So following that thread, I'm going to try something a little new today. Good morning, Ian, which makes me a little bit nervous, as we all know, but I'm going to give it a go anyway. It's a poll. So I'm going to pop the poll in the chat. Hopefully you can all see that. Nods, waves, no, smiles. Anyway, the question is, same patient, same problem, different access route into practice. Do your patients get the same outcome? That's the question. Hopefully you can all see the poll. Nobody's telling me you can't. So I'll carry on and do my, yeah, that's my icebreaker. Anyone answering? Can we see it? Ellen, Gemma, can you see it?
Yes.
Okay, that's all I needed to know. Right, well, whilst you're doing that, and as you know, don't think too hard about it, just pop your answers in the chat. I'll do the usual bit of housekeeping. So firstly, to say the call is being recorded for prosperity and sharing. If you are busy and need to drop off, don't worry about it. You're not going to miss a thing. We're aiming to keep you for no more than 30 minutes. Second of all, we love the questions. So please pop those into the chat as and when they come to you, and I will answer them or get the ladies to answer them as and when we can. My name's Lucy Glynn. I'm the community manager here at Exxon Health, and with me today, we have the titans of operational efficiency and patient experience. That's Ellen Gatlin, give me a wave, head of customer experience, and Gemma Curtin, customer success manager. Welcome back. I can't believe you're here after everything I put you through last time, but thank you for being here. It's great to have you. Ellen, we're going to start with you today, I think.
Mm-hmm.
And absolutely nobody's answered my poll. Can you believe it? I'm outraged. I tried a little bit of new tech for the first time ever and nobody responds. Right, fine. Well, whilst I curl up in a ball and feel miserable, you're going to tell us what equitable access means to you.
Yes, thank you very much, Lucy. Lovely to be back on another wonderful webinar with our Exxon customers. Going into equitable access. So I think for me, this is a particularly passionate subject of mine, looking at all of that patient choice. And I think when we talk about equitable access, it's quite easy to immediately start thinking about the channels that we use. So telephony, online consultation, NHS app, chatbots, voice agents, websites, but stripping it right back, equitable access isn't really about the channels. It's actually about recognizing that our patients are different. So for one patient, submitting something online at 10 o'clock in the evening is actually incredibly convenient. But for another patient, speaking to someone on the telephone is essential. And you may have others that need support because of language barriers, digital confidence, accessibility, or simply because of the specific circumstance they might be ringing about. So I think the goal shouldn't be to make everybody access general practice in exactly the same way. The goal we're looking at achieving is to actually make sure that whatever route a patient chooses is that they can actually reach the right care. And we know we've made significant progress in giving patient more ways to do that. But the question I'm asking today is actually, has more access automatically created more equitable access? So when we're looking actually at the data that's available, we can see from the patient survey results that there is a positive story to tell. The latest GP patient survey shows that 72.6% of patients now describe their last experience of contacting the practice as good. And we've also obviously seen improvements as well across telephony, the practice websites and the NHS app, which of course this reflects a huge amount of work that's going on across general practice. But actually the averages only give us a very small part of that story. And we know that the uptake of this survey is particularly low. So a new digital route might make access significantly easier for someone who's really confident online. But what about someone who isn't? Someone who has a language barrier, accessibility needs, or the more complex circumstances. So when we're thinking about equitable access, we need to look beyond how many people are actually accessing a service and start thinking about how different groups of patients experience that access. And then, of course, there's another challenge here. Even when we give patients lots of ways to contact us, those different routes don't necessarily always join up. So let's imagine I've submitted my online consultation request. I receive the SMS asking me to call the practice. I call the practice and join that telephony queue. I speak to the receptionist, and actually then I end up discovering I need another service. Technically here, every channel has worked. The online forms worked, the SMS has worked, telephone worked, reception worked, but that patient journey didn't. And that's the really important distinction here, because every time we keep adding new access channels without thinking about how they might connect, we actually risk creating more complexity, not just for our patients, but also for the practice teams. Patients quite typically repeat themselves. They'll move between channels, trying to work out how our systems actually operate. And behind the scenes, practice teams end up managing several different workflows, which becomes a huge operational burden. So the answer isn't fewer ways to access care. It's actually making all of those amazing things that you're using work together nicely and connect together in the background. And this is where at Exxon, and you as a current customer or prospect customer, is where we have a real opportunity. We want our patients to have the choice. If digital works for me, brilliant. If I prefer the telephone though, that should work for me too. And if I want to speak to someone, I should be able to do that. But offering the choice to patients should mean creating 3 or 4 completely separate processes for the practice. The front door can be different, but what happens behind it should always be connected. And that's where Exxon's digital tools and intelligent care navigation can actually really help patients find that right service, complete the task they need to, or identify the appropriate pathway that they should be following. And importantly, we can bring the exact same thinking into the telephone as well. A voice agent, for example, OmniConsult, it means a patient who chooses to call can actually still benefit from the automation and the intelligent navigation as well. We're not asking them to become a digital user just because that's easier for our systems. And that's the important point, is that we don't want technology dictating how patients access care. It should help whichever route they choose work better. But of course, if we're going to do that, we also need to think differently about how we're actually deciding whether it's working. And I think when we look at all the data, there is so many dashboards and data metrics that we can look at. Very traditionally, we might introduce a digital tool and look at whether telephone calls have reduced, for example. And that's really useful, but it doesn't necessarily always tell us whether the access has actually improved. So if our calls have dropped by 20%, brilliant, but is that because the patients found what they needed elsewhere, or actually did the patient struggle and simply give up? And that's why we need to move from measuring individual channels to actually understanding the whole patient journey. So rather than looking, did call volumes actually go down, the questions that we want to be thinking about is who is using each route, who isn't, why aren't they, where are patients dropping out, how often are they moving from one channel to another? And when somebody needs human support, actually, how easy is it to get there? Because ultimately, the success here isn't about pushing the highest number of people online. The success for our patients is reaching the right care as easily as possible through the right route that works for them. And that brings me back to where we actually started. Equitable access doesn't mean digital access, and actually it doesn't mean telephone access, it means connected access. We shouldn't be asking our patients to understand how our technology works, which systems sit where, or which channel they need to use for a particular request. That is our job to solve behind the scenes, working with you as our customers as well. And our opportunity is to actually give patients the meaningful choice that they want. So digital when it's convenient, telephone when it's preferred, and human support when that's appropriate. And I'm going to hand over to Gemma here, that's going to give you a bit of a real life example of how we're really seeing equitable access used across our product stack at Exxon.
Thank you. Ignore my really dodgy looking slide. I just wanted to pop some bits in just so that we can see what that actually looks like from the back end if you are using the Surgery Connect service. So the system is amazing and it is bespoke, so we can tailor this exactly to you, but just an example of how we can actually build all of that into one place. With the Surgery Connect system, you do have the option to use menus within your call flow. So we can start doing some of that signposting out. So if people have chosen to actually use the phone to call in, we can then start educating them on what other services are actually available. So we can start hiding some little hints into where you'd like people to go and what that digital access looks like. We can also incorporate our voice agent. So like Ellen says, as people call in, they don't necessarily want to use that digital option, but this is giving an option for them to go through your automated voice agent, and it's keeping everything linked up in the back end of your service as well. These come through nicely on your little phone bar, so it's all nice and linked up. We do also have the option of adding SMSs. So within that SMS, we can signpost to a chatbot, and that digital assistant can sit within your call flow. It's fed with all of your local services and your local information, so it can signpost people out, or it can give them routes that will work best for them. That digital assistant is also available to be popped onto your website. So if you do have those patients that are more digitally inclined and they do start on your website, they can actually access it through there. And then if they can't find the information they need, they can actually contact the practice directly through that chatbot as well, keeping everything streamlined and everything all coming through to one individual service within the practice. There's lots of other features that you can incorporate on here as well. There is features like the check and cancel, where they can automate, or an automated system where they can check and cancel their appointments as well. And this will all help within the practice. And all of this is reportable. So if you haven't seen it yet, there is the Insights dashboard. I know that we've done lots of talking about it recently, but if you are a Surgery Connect customer, that does pull all of your data into one place. So we can actually deep dive into what patients are using those individual channels and how we can help support you actually grow the areas that you need to grow within your practice.
So a couple of questions to unpack there, I think, Joanne, because this is your bread and butter. You do this all day, every day, and this is possibly one part of what the people on the call do on their day-to-day basis. So I just trying to pick your genius brains here a little bit. It sounds a bit tricky and a bit of an oxymoron, but anyway, could you give us an example in the first instance of where you've seen that looking at the data and understanding the patient demographic make a real impact on the tools that were used and the patient journey having that impact? I'm thinking of Stamford Hill. I'll give you the clue. So I'm thinking of Stamford Hill, where they had
You're going to pick the one site that I don't know any of the data off the top of my head, aren't you?
Apparently so, yes. You can see how prepared I am. So no, but it's an interesting one to me, only because they had such a niche patient demographic that we had to build the solution around it, and that seems to make a real impact. Correct me if I'm wrong.
It does. No, it definitely does, and every practice works very, very differently. So that's part of our digging that we do within the practice, is working out how your demographic actually responds to the information that we're giving them, because if it's not landing with your patients, it's not worth it. It's just a waste of time them actually listening to the information. I know that the site that Lucy said have been set up very much like the one that you've got on your screen. So it's giving people very specific options. They can either go through that digital route, they can utilize that voice agent, they can still choose to speak to a human if they'd like to do it that way, and you have got the automated services. So that one's very much a case of giving them full choice. There are lots of sites that have bits built into the background, so it's more like guiding patients through that journey, but also picking out those patients that would also struggle with the information that we're giving them and prioritizing those calls so that they avoid the information there. When it comes to stats around it, we do have practices that have seen fantastic changes or fantastic improvements. We have one practice that even incorporating the check and cancel feature managed to drop their DNAs from 8% to 3.6%.
Wow.
And it's all about looking at what is actually working for those individual sites, what that patient demographic is, how we can actually phrase the information we're giving them so that it's actually relevant information at point of need, rather than them just listening to lots of gumph on your system and not just telling them they need to go somewhere and hanging up. We're giving them all of those digital options and different routes that's going to work for them.
And I think quite typically we can sometimes over panic about how it might land with the patients. We almost give them too much information, I guess. And I think even going back to when we first introduced online consultations, huge panic, patients didn't like it. And now look where we are with those. Quite similarly with voice agents now, it's now there, it's now available, and it causes great panic when you almost over prep the patient and then them becoming nervous about it. And like we go back to that patient choice, actually, you might have a particular patient, you think they're never going to use a voice agent, but actually in that long call queue, they think, do you know what, I'm going to give it a go. And that patient journey works. And then you almost convert that patient into using that voice agent and not going back to diverting to the receptionist, which obviously then opens up those reception lines to those more in need, those that have accessibility, language barriers, whatever those reasons might be, or the more complex urgent circumstances as well.
Have you got any tips between you on how best to start to understand the patient demographic and what needs to be shaped around them? It sounds like an obvious question, but I'm trying to unpack where the people on the call might start in trying to understand that.
Yeah, I think the initial starting point really, if you are a customer of ours in a deep dive, we would ask you those questions around the demographics to understand what does that typical day in the life of a receptionist look like, and what's that standard demographic coming through. Like we said, with every practice we have different needs. Stanford being a great example of 90% of their population were not going to use an online consultation. They couldn't, simply, they were unable to, which is why in this example, a voice agent has been transformative for that practice, because it's allowed that online channel, but they're using their telephone to do so rather than having to access the internet. So I think it's almost doing that deep dive into that patient demographic to understand what are the challenges that are coming through, where do the frustrations lie with your patients, is it a particularly elderly demographic, have we got language barriers, and then from those conversations it allows us to appropriately advise, actually you're missing a bit of a trick here, we can implement this product, this feature, which can really help support in alleviating some, never all, some of the pain of those particular patients.
And I suppose at this juncture, it's pertinent to say that if you do want the crack team of customer success experts here to reach out and chat to you about a deep dive and understanding your patient demographic, pop your ODS chat number in the chat right now, and they will do just that. As you can tell, they're very, very knowledgeable. So do fire your questions whilst we have them, because I'm not sure we'll get them back anytime soon. They don't like webinars. So I'm just laying it bare. So, all right. I do have a few more questions. And I suppose one of them is leaning into the results of the poll, which quite rightly has been pointed out to me. We did have some responses. I don't need to panic or shout at anybody. They're right there in front of me. I just haven't got it on the right screen. So leaning into that, the responses are quite interesting. So the question was, same patient, same problem, different access route into practice. Do they get the same outcome? 40% said, honestly, I'm not sure. 27% said, no, the journey is consistent. And sometimes was about the same. So honestly, I'm not sure was the out and out winner. So I suppose you've kind of answered this question, Elle, about where you start. It's with the deep dive in those questions. But the data, if they've got access to Surgery Insights, what would they be looking at?
obviously dependent on the products that you're using with us, but ultimately the reason why Surgery Insights got put together was because so many customers were saying we have all of these different data metrics to look at from all these different sites, and actually we just need one place to really be able to digest and understand what's actually happening in our practice. Insights gives you a really granular view of, most importantly, telephony data and what that looks like, but we're also able to work with you there on identifying if there is a significant change. Perhaps your missed calls has decreased quite significantly over a 2-month period. We can really start helping to identify what is it that you're changing in practice to reduce those missed calls. So a good example here would be a site that have recently gone live with Surgery Assist, our digital assistant. We implemented Surgery Assist within the call flow. That basically allows the patient to come out of the call queue and instead speak to a digital assistant, which can actually answer a lot of the administrative questions that are coming through practice, test results, referrals, prescriptions. We saw the number of missed calls decrease quite significantly, and actually abandoned calls increase, which isn't such a negative metric that it's seen for. But what we were able to see is that decreased number of missed calls, increase in abandoned, correlated quite beautifully into that usage of Surgery Insights. So able to really see that we can see that demand is coming out of the call queue and actually not hitting the call queue because it's just within that menu option and it coming straight out into Surgery Assist. And then that patient is able to get the appropriate outcome that they needed via a digital assistant.
And it's nice that you mentioned Surgery Assist because that's gone through some changes recently, hasn't it? And there is a new version that might be worth exploring for those who have looked at it and perhaps dismissed it in the past. Maybe time to revisit it. For those that have never heard of it before, certainly time to revisit it with some very exciting new changes and releases coming out there. One other question, I suppose, we've talked a lot about the patient experience and looking at their journey. I just want to shout out to those that are on the call, their operational version of this, because they might be thinking, if we're giving patients genuine choice across multiple channels, how are we doing that without creating different workloads, separate workloads for everyone to deal with on a daily basis? In essence, creating more work for those that are working in practice.
Is that a question to me?
Well, I'm throwing it out there. You're the experts. You can wrestle over it if you like.
It's ultimately the beauty of intelligent care navigation. It's with Exxon, you've got everything in one place with one system in the background. What we're trying to achieve is where you've got one connected system in the back end. We don't want to increase lots of workflows, particularly for receptionists and clinicians that are dealing with that day-to-day burden. So it's one connected system in the back end. And actually, as far as the patient's concerned, it's one system if you do it the right way. You don't want it to feel clunky. And we know patients love to break the system and they love to find ways in that they can. But if it's done in the right way, you can achieve fantastic results, both from a patient perspective, but also then from your practice perspective operationally. And all of those journeys then become seamless, right? You've got a brilliant customer experience and therefore a brilliant employee experience as well, patient experience, employee experience. So all correlates quite nicely.
It's the dream, isn't it? It's the absolute dream. I'm running out of questions and it seems I'm the only one with any today, which is fascinating to me. But now is your last chance. If you've got any questions, please pop them in the chat. And likewise, if you want them to reach out to you to have that deep dive, put your ODS code in the chat. One final question from me then. So we've done all this work. It's had a fantastic impact, we think. How do we know that the patients are now receiving that seamless experience, and despite whatever route they're coming in, they're getting the same experience?
I guess we've got the data to back it up. We've also got some fantastic case studies from some of our sites as well, where we have seen sort of quite a huge transformation, Cambridge practice being one of them, speaking directly with their PPG to hear of the success story and actually the ease that they're finding in actually accessing the practice as well.
I think that's what I was trying to get to, because I meant from the practice perspective, you do all this work, how do you know it's having the positive impact? But I guess it's braving the PPG, is it? With support from Ellen and Gemma. I threw it out there.
Not just braving the PPG, but we want you to feel the impact as well. And I think naturally, if you've got happier patients, you're gonna feel that impact in some way in practice as well. But I was going to say, if you are looking at a deep dive or actually rather than a deep dive, want to have a bit more of a data deep dive and have a look at insights and what's available, we are also very happy to pick up those calls as well if that's something you'd be interested in. It doesn't just pull you into a deep dive in your demographic. We can also just show you some data so that you can understand what is actually available there.
And it has to be said, I'm glad you brought up the Cambridge practice, because it's well worth a watch, that case study. It leans very much into understanding the patient demographic, the patient journey, and making the changes that by the byproduct of which is having that impact on the operation team, isn't it? It was phenomenal. And somebody said to me yesterday, the very last line in the video is Claire, who is practice manager at the time, now DTL, I believe, just almost on the edge of tears, going, it's just better. It's just better. I had to reach for the Kleenex. Honestly, it was quite emotional. Anyway, I think that's it from us today. Excellent. We've got a couple of ODS codes in the chat. That's good to see. I'm glad people are making the most of it, because you guys are the absolute crack team, and the difference that you've made to the likes of the Cambridge practice are phenomenal. I'm not just complimenting you because I want you to come back and do it all again, but thank you for being here. I think that's it from us today. We have finished ahead of time, which is, I don't know, almost a record. You can tell Max isn't here. We hope you've enjoyed it. A big thank you to Gemma and Ellen for their time, and for all of your participation, especially on the poll. New technology makes me very nervous. We'll make this webinar available to you in the next few days via the email to anyone that's registered. We'll do it all again next month, which is just ahead of what can only be described as quite an exciting exhibition season. I think we've got 12 in 1 month. So hopefully we'll see you out on the road sometime soon. In the meantime, have a happy and healthy rest of August, and we will see you in September for much, much more. Stay tuned. Thank you for being here.
Thanks, everyone.